So uh, what I would like to do right now is get my APRA registration done, and then it really depends on me and my wife and when we decide to do the move. But hopefully, it's not going to take us too long. Maybe a year, I would say.
All right. And
Inshallah.
what about the IELTS? Are you planning to get it done?
Sorry?
The English exams, the IELTS.
Yes, I will have to do it before I move, definitely. So, and I think it's a prerequisite for APRA at the moment for someone
Yeah,
that
it's a
has
prerequisite for APRA registration. So you can have the IELTS exam taken, or you can have the PTE taken as well, which is a Pearson test of English, right?
the Pearson.
Comparatively, yeah, comparatively, the PTE is a bit easier compared to the IELTS exam. But again, it's your preference because some candidates do struggle with IELTS. But I don't think so that would be a problem because they just need the basic 7 score. So I don't think that would be an issue. And
Oh,
you should,
so
yeah.
so it's a basic 7 score and not seven in each subtest, like how things were back in 2013, right, Doctor?
No, it's still 7 in each, but
Okay.
I won't say that would be hard to get. It's the writing part that's a bit tough. But again, like I said, you can always go for PTE because with PTE, it's an occupation-based test, right? So
Okay.
comparatively, it's a much easier. Cost-wise, both are the same. And you're currently in UE, so you will have centers for both the exams, so that won't be a problem. But yeah, for
Perfect.
the APRA registration, you would need to have the IELTS exam at least, yes. And then, of course, all the other documentation, which you can gather in the next few months before you submit the application, because the application is quite lengthy, right? So you need to make
Yes.
sure to fill all the prerequisites before. But the thing is that I think previously they were asking the candidate to come to any of the ADA branches to have their pictures and their thumbprints taken.
Yes,
Uh,
I believe it's the same. Or has it?
I don't think so, actually. It's online now.
Okay. Very
That's
good.
what I heard because we had a few candidates who cleared the exam last time as well, a few months ago. So I was just checking with them, and at our time it was that we had to come to Australia to have our fingerprints and everything. But I think
Yes,
now
sir.
it's online. So if it's online, so you will save a visit technically to come to Melbourne and do that. But yeah, I think you can check because I think it's not applicable for all countries and residents of all countries. So you need to
Okay.
check and email them, and they will help you with that. All right. But yeah, the hard part is done. So the exams are done. That's the tough part. All other things are secondary and they will also be done hopefully with time. All right.
Allah. Thank you, Doctor.
Okay.
Thank you,
Now,
sir.
a few questions that I will ask you first. Just basic questions about the exam and everything. And then if
Sure.
any
Of course.
candidate has any questions, they can always ask as well. All right. So the
Okay.
purpose of this session is OET, sorry, someone asked OET. Yes, you can give the occupation English test as well. That's accepted by APRA.
Yeah.
Okay. So that would be fine as well. Okay. So the purpose of the session is just to, help the candidates who are preparing and who are going to give the exam the next few months or early next year or mid next year, just to know the approach that needs to be taken. Of course, before I ask Dr. Umar what approach he took, please remember that no single approach is a standard. All right. Every candidate has different method of preparing, different method of going with the preparation of different tasks of the exam. So there is no standard approach, okay? But we'll get to know about Dr. Umar's approach because he was not in Australia and he did successfully clear the exam, both the exams in first attempt, okay? So that's a great achievement. And also it reflects the hard work that was put in because he has never worked in Australia,
Thank you, Doctor.
neither
Thank
as
you.
an assistant, neither as any clinic manager or something. So it's an indication that candidates who are not even in Australia, they have a good chance of clearing the exam. Because sometimes I do get to hear that I need to work as an assistant or this and that. Tell you very frankly, it does not make much of a difference. All right. Dr. Umar has done it. We have many candidates from India, Pakistan, GCC countries, Arab countries who have done them, done the exams and cleared both the paths. And they have never stepped foot in Australia or New Zealand. So it's more about the preparation that you're doing. And of course, ADC also knows this because this is an overseas exam. It's not a local exam. So they know these candidates are coming from overseas. All right. So there is a lot of misconception that I need to work 2 years as an assistant or this many years. These all misconceptions are wrong. Yes, maybe working as an assistant will help you cope up with the clinical practice, day-to-day practice, but with exam point of view, really does not help much. Okay. All right. So with Dr. Umar, the first thing that I would like to ask you is that how did you prepare for the exam?
Okay, doctor. So for the first part,
Yeah.
I gave myself around, I would say, 8 months of study time. So I
Okay.
divided them. The first 4 months were the reading part. I remember with your course, you had given us summarized parts of textbooks so that we can read to prepare for the theoretical portion. I gave myself 4 months to make sure that I've read that thoroughly. And then for the subsequent 4 months, I went through all of the past questions, made sure that I read them thoroughly, check the answers. If you recall, I would ask you sometimes, I would even check with you with the answers just to make sure that I understand why this answer was chosen and not just to memorize it, because it's very important to understand the answer because they do sometimes change the format of the question. Even though the questions are more or less repetitive, sometimes they do change the format.
Okay, all right. So in your opinion, roughly 6 to 8 months are required to be prepared for the written exam.
Yes, absolutely.
Okay, all right.
I think
And
the
the
written
candidate,
exam,
yeah, sorry, continue.
sorry, I think the written exam requires more time to prepare than the practical exam, but at least this was the case for me. I have been practicing for the past 13 years nonstop, so the technical part for me was not as tough. Maybe what was new was the communication aspect, because as you're aware, from every culture you have different mentalities, and addressing a potential Australian patient might be a little bit different from the patients that I'm used to dealing with on a daily basis. So, but I guess the practical part, I only needed like around five months, I would say.
Okay. So once you cleared the March exam, you
Yes.
attempted the practical exam in September, as I can recall, right? So you
Yes,
had
straight
roughly
away.
4.5 months, right?
Yes.
And out of those 4.5 months, I would say maybe half a month or a month has been taken by the preparation and getting all the equipment and the materials for the exam. So roughly, I would say 3.5 months, 4 months, right?
Yes,
So
I would
in
say.
your opinion, because candidates are going to sit the exam, they cleared the exam in September 2023, and they're going to go for the exam who have roughly 4 or 5 months to prepare. So you believe that these many months are sufficient to prepare for the exam?
I think for someone that has been practicing, this is more than enough time.
Okay, all right. Now, by practicing, you mean someone who is an active dentist, right? Anywhere in the
Yes.
world practicing. So when
Yes.
you sat for the exam, how did you find it? Like, is it related to day-to-day clinical dentistry life, or it's completely separate from it?
I wouldn't say completely separate. I guess it depends on the task. So some tasks you're not going to prepare the same way in the like you would in the exam. For instance, the cavity preparation. No one prepares it this way usually. I would say usually the task is very conservative compared to real life dentistry. When it comes to the preparation task, I guess it really depends on what kind of crowns you do on a daily basis. So if you're used to doing a PFM crown, like a partial veneer, a partial veneered metal ceramic crown, then this is probably the same preparation you're going to be doing all the time. Same goes for the resins, same goes for the amalgams. These are very similar to what I would be doing on a daily basis.
Okay, so someone who's practicing daily, or maybe they're practicing as a dentist and doing these tasks. So for them, it is much easier to get hold of the criteria of the ADC and then start practicing on the plastic tooth, right?
Yes.
Okay, all right. Now, how much practice did you do for the practical exam?
For the technical aspect, I would say I tried to work on a daily basis. So, as you're aware, doctor, I did not have a home setup. I was practicing at work.
Yes.
I took permission from my superior that I can practice in between patients and after hours. To be honest, I never practiced. Like I rarely practiced after hours. So I kind of crammed all the work I could do in between patients. So I'd say roughly I would do a couple of hours to 3 hours of technical practice
Mhm.
every single
Okay.
for
So
five,
that
let's say five.
means, so that means that you had roughly 6 technical tasks, right? Which needs to be performed on the mannequin. So you did
Yes,
each at least 10 to 12 times, I would say
I would
roughly,
say
right?
yes.
Yeah.
Some were more, some were less. Yes,
Okay,
but
depending
on
upon
average, we'll say
how long it takes to achieve the criteria. Okay. Now,
yes.
apart from this, so you would say that the candidate needs to practice each task, at least I would say a rough range between 10 to 15 or 15 to 20 times, right? Because
Yes,
initially when the candidate is practicing, it's just getting hold of the task, and then as moving along, they understand what mistakes they are making and they start to improve on that. Now, the
yes,
other thing that
absolutely.
you said interestingly is that you did not have the home setup, as I can recall. So you
Yes,
used to practice at your clinic after the working hours. Okay. So that's also not an easy thing to do. So looking at the dedication of Dr. Romer, that once you work for 8, 10 hours, and then after that, you are taking time out to prepare for the exam. So it's not an easy thing to do, to tell you very frankly, because if
thank you,
you're
doctor.
working that long and then you take time out to do practice, and the thing is that with the practice, you're not getting rewarded at that time, right? For example, if you're seeing a patient, the patient pays and everything, so you're getting rewarded. But for the practice, it requires a lot of self-discipline, because you need to do practice not knowing where I stand. You start the practice with the way that you need to make sure to follow the ADC marking criteria, and then one day you achieve it, which Dr. Umar did eventually. So it's more about self-discipline, dedicating time towards the practice, that you need to unlock the criteria and then make sure that your task fits within the ADC marking criteria. All right. Okay. So for the materials, like for example, you were overseas, right? So for the
Yes.
materials and everything, how did you arrange them? Of course, okay, you had the dental unit and everything with you at the clinic, but of course you had to purchase the teeth and the material and the all the other stuff. So how did you manage that?
Well, for, because I live in the UAE,
Mm-hmm.
Nevada, the Nevada website was the one that I relied upon the most.
Mm-hmm. That's the one
Given
in
that it's,
Mumbai, right? Yeah,
yeah,
India, yeah.
that's the one in Mumbai. Given that it's closer to the Gulf, so ordering from there would not be as costly as it would if I would order something from One Dental, for instance.
Okay. So you had
I
everything purchased and delivered directly from them.
Yes, and of course I would need to top up every now and then if I feel that I've run out of, let's say, caries teeth, and I
Mm-hmm.
feel like I need to do more. I would order more. So it wasn't a one-time purchase,
Mm-hmm.
but at least the main bulk I got, of course, at get-go.
Okay, all right, that's good. So the other thing is that the courses that you attended, both for
Yes.
the written and the practical exam, of course, I do understand that you were with us for both the parts, but what was your intake? What was your feedback and everything regards to the courses that you attended? When you came to Australia, I think you attended a few days course as well, so that you can just brief us about that.
Absolutely. So with your courses, doctor, I dependent upon them 100%. So I did not do any extra material. I did not attend any other courses until I went to Australia with your recommendation and attended with the 101 Dental for the
Mm-hmm.
mock
Mm-hmm.
communication test.
Mm-hmm.
But other than that, it was only relying upon your courses, your materials, and your tips and tricks for the technical work. So this was 100% what I was relying on, and I
So
found them to
you
be.
completely practiced and prepared for the exam through our online course, and then a few days before the exam, you came here and had a mock exam done. That's what you did, right?
That's exactly what I did. Nothing more.
Okay, all right. Now, with respect to the OSCEs, the communication OSCEs, did you
Yes.
have an OSCE partner?
No. It was just your sessions, doctor, and then I would just more or
So
less
I was the
pretend that
only OSCE partner that you had.
until I went to
Yeah.
Australia, and as you remember, I told you
Yeah, you
I was
had
staying
your
with them.
friend you were staying with. Okay, all
Yeah.
right.
So
So,
that's about
so,
it.
so, how did you prepare for the communication OSCEs then?
So what I would do, because I didn't have any person I can practice this with comfortably, because I don't have any dentist that I can just do this with, I would
Mhm.
just sit in a quiet room, I guess. I would start asking questions, just talking to the thin air, and then I would give myself maybe uh, 5 to 10 seconds of waiting time, as if I
Mhm.
have someone who's replying to me.
Okay, all right. So you had the access to the course portal that we had, which had all the communication OSCEs, right? So when
Yes.
you went in for the exam, you had, of course, communication stations. So
Yes.
did you have any new cases, or all the cases were repeated from the one that we had in the course portal?
No, all of the cases were repeated. I did not have a single new case.
So you had
What
an
was
idea about all the cases beforehand.
Yes, but what was a little bit different is that unlike where you give the minimal information, doctor, with the case outline, so
Mhm,
that we would ask more questions and have
mhm,
more
mhm,
communication time.
mhm.
They would include more. They would include parts that you
More
already
details about the
more details
cases.
in the case. So while it lessened the amount of time or lessened the questions that you would need to ask the patient, it took
Mhm.
a bit more reading time. So this is something that the candidates need to know.
Okay, so basically it means that because most of the details that are given in the cases, you don't need to spend time asking and repeating that because you're not getting any score for that. So you need to be more case oriented and read the case very carefully and omit asking those things that are already present in the case so that you can structure the case in a more appropriate way. All right. Now,
One thing,
yes, please.
one thing in addition, doctor, and I've noticed this from all the I've asked a few candidates that have taken the exam before when I was in Australia, and from
Mhm,
my personal experience as well. Uh, in particular, cluster one,
mhm.
the patients tend to not answer in a direct, calm manner like what you would expect them to.
Okay.
So, in my particular case, one of the cluster one cases,
Mhm,
it was the child, the 5-year-old child case with the buccal abscess, the one that you're supposed to be conversing with her father,
mhm,
and he would not stay quiet for 7 straight minutes. He would just talk,
mhm.
not giving
Okay.
you any kind of answer. So while it's the same case that I've read and practiced multiple times, it was a little bit of a different scenario when
Because the
you're not
patient
expecting.
was speaking and they were not letting you communicate, and you were scared that the time will go off and you won't be able to ask all the relevant questions.
Exactly. Yes.
So how did you manage yourself in that situation?
Well, I knew that, well, first of all, the examiner knows exactly what he's saying. So this is something
Mhm,
that kind of reassured me. I know
mhm,
he's not just talking out of thin air. He would throw information that I need every now and then. I would just kindly interrupt and tell him, oh, so you meant this. So you
mhm.
meant that. So you mean this. So you
Okay.
mean that.
So
Okay.
you
And after that,
smartly interrupted whatever the feedback the patient was giving you, which is the examiner. And then
yes,
depending based on that, if there was anything missing, you tried to ask the patient.
exactly. And then the examiner left me around 3 minutes to discuss my investigations.
Mhm,
And because he's aware, of course, that he's taken up a lot of the time, he
mhm,
would more or less indirectly ask me to brief it up.
mhm,
So I wouldn't go in depth in the investigations. I wouldn't go in depth in what I'm expecting the patient to do, risk
mhm,
factors. If I remember, for instance, he did mention something about his daughter eating a lot of
mhm,
muesli bars. So when I
mhm.
mentioned muesli bars, okay, we need to. He was like, yes, yes. So you mean carries risk manager? Okay, next, and so forth.
Okay.
So even though he might try to take up a lot of time, they are aware of the time limit and they are aware that they need to give you some time to speak as well.
Yeah, sometimes because they speak a lot, they of course understand that the candidate's input is required. So of course that's not possible that they'll speak for 10 minutes, but sometimes when you ask them a question, they give you a very lengthy answer that might take up a minute or two. So yeah, that's something that the candidates need to know, because sometimes when you're asking the patient a question, for example, can you please describe your pain to me? They will start speaking and speaking and speaking, and this is that, this, that. So it's not your duty to interrupt the patient. Let them speak because they know you have 10 minutes. So it's not that they're eating your time. They will give you information here and there, which you can smartly interpret and then ask anything else that you would like, which is in respect to the significance of the case that you have in the exam. Okay. Now, the other thing is that the technical task, right? Because you were practicing these technical tasks all the time without being in Australia, without having any courses attended over here. So, how did you know if you were following the right criteria?
Well, the rubrics are very clear, and
Mhm,
I would always compare them again with your feedback so that I would
mhm.
make sure that I'm following the rubrics. And over time, it just becomes muscle memory.
Yes, the thing is that that's one good thing because we remember that you used to send us work after every time you did, which is a
Yes.
very good thing because once you get a feedback, you will know your mistakes so that you can avoid them. So that was a good thing about you because whenever you practice, you used to take pictures and then send us the pictures for assessment. So that's something very, very important. All candidates who are with us, we do encourage them that once they get into the practice, because technically you will just need a few weeks of feedback, but then like Dr. Umar said, that you will understand where are you going wrong automatically. All right, and because we have the assessment and the feedback videos in the course portal as well, which automatically helps you know how the ADC is marking your criteria or your task, and then you can see where you fit yourself once you do the task. All right. Okay, and how did you get your work assessed? Did you have anyone physically present in UAE to go to have the task assessed, or you just based yourself on the feedback that we provided and the online videos that we have?
Well, I didn't have anyone that has experience with the ADC examination rubrics, if
Mhm.
that's what you mean. But because I work in a center with a lot of specialists, I would also take their opinion every now and then. But of course, it wasn't as reliable as yours, as they had no idea what the rubrics for the
So you didn't
examinations.
have your task assessed physically on site through anyone. You just smartly assessed through the videos and the feedback that we used to give you when you sent us your task. All right.
Yes, you
Because a
were
lot
the
of
only
candidates
one.
do ask me, should I book regular assessments with any mentor to get my work assessed? So I don't usually recommend that because, okay, you can do it once or twice, but it's not a regular thing. You can learn a lot by yourself by watching videos of assessment criteria, what the ADC is expecting from each task, technical task that you're doing, so that it becomes easier for you because you cannot always rely on the third person. It's your work. You need to know once you finish the task whether you fit yourself into the marking criteria or not. Okay. All right. Dr. Omar, thank you for this. Now, just a bit of exam experience. Like, of course, exams are stressful, I know, and it's not easy. And especially when you're traveling, you need to stay in a hotel and then appear for the exam. So, what was any particular thing that you did to cope up with the stress of the exam, especially both the days? Is there anything particular that you did? How did you manage to calm yourself down and make sure that you are calm and doing the task appropriately?
Okay, to be fair, doctor, I was always worried more about the communication, about the OSCE day in comparison to the
Mhm,
technical day, as you're aware.
mhm,
And I'm telling you very frankly, the first OSCE task, the communication OSCE task that I had was a cluster one task. And
mhm,
because I was stressed and I really did not know what to expect, I'm telling you frankly, I failed that task. So it was one of the fails that I had in the exam. Uh, as soon as I recognize that I'm not doing as I'm expected to do, I just,
mhm,
I calm myself down. I'm like, okay, look, at least now I've had the first task. I know what to expect with the upcoming
mhm,
five communication ones at least.
mhm,
Uh, it's a day. It's going to pass. In the end of the
mhm,
day, it's just a few hours.
mhm,
Okay, I'll just do what I've been doing. Just consider it to be a normal practice day. Okay, just
mhm.
different people,
So
and that's how.
basically, you mean that after the first station where you panicked and you thought you didn't do well and you failed that station, you compensated for that bad score in the remaining station. Of course, you
Yes,
did, right? Because
exactly.
if you failed station one and you passed station two, it means you did considerably very well in station two, so that your score for the station one was compensated for.
Exactly. Yes,
Okay, okay,
exactly.
all
And this
right.
is something that people need to understand. They don't have to pass every task. Mm, Very rarely do people pass every task. It's
Mhm.
still not an indication that they're going to fail.
Yeah, as long as you're making sure that you give your best for each station, and if you feel something went wrong in the previous station, make sure that you give your best for the next station so that your tasks are compensated and you pass the cluster as a whole. Now, with the technical day,
Yeah.
were there any problems that you faced during the exam with the setup that the ADC has given each candidate with the instrument, dental unit, and everything? Was everything in order?
Personally, I did not have any problems at all. Everything went very smoothly. I recall you had told me that sometimes some candidates have complained that the temporary crown material, for instance, doesn't set. Mine was
Mhm,
completely fine. The indices were okay. No, I don't
You
recall
didn't have
having.
any problems with the provisional crown or the amalgam, because some candidates says that the amalgam sets quite fast, so you had sufficient time to carve it and make sure everything was fine.
No, well, because I've been using standard two-spill amalgam, doctor, the amalgam that I've used in the exam was actually slower than what I'm used.
Okay, so you were using the standard that used to set fast for the exam because they have the extended carving time. So it
Yeah.
takes more time to set, and the candidate has more time to easily carve the amalgam,
Yes.
right?
Yes, it
Okay,
was
so that
actually
was
a
a
lot
clever
slower.
thing that you did, because if you're using the other amalgam, that sets faster, the regular one, right? So in the
Yeah.
exam, you have the ECT, which is the extended carving time, and it becomes a bit more easier for the candidate to have the task done and do the entire carving. So how
Yes.
was the environment like? Did you feel that the environment of the technical day was stressful, making sure that everything with respect to infection control is also in order while you're doing all the tasks?
Okay, so they were extremely helpful. All dental assistants and infection control personnel, they were extremely helpful.
Mm-hmm.
Uh, some people had minor. I even had an accident. Okay, I remember I knocked off the handpiece while I was manipulating a filling. I believe I knocked it off by my shoulder by mistake. Uh, I just told them, look, something has happened and I need to discuss it with you. And I remember the head nurse came over. She's like, okay, what happened? I told her 1, 2, 3, 4. And she started asking me very simple questions about, okay, what am I going to do now?
Okay, like if it
Uh,
happens in a clinical environment, what are you going to do? And you give them the answer.
exactly. You give her the answer. If the answer is correct, you're done. It's as if nothing has happened.
Okay, and with respect to the material that you had in the exam, did you feel that
Yes.
the material was of standard? Everything was
Yeah.
fine and new and fresh for each candidate?
Yeah, yeah, absolutely. And they're very like they will give you as much material as you want as well. So you wouldn't have to worry about finishing what you have in your drawer. You can always go to the uh,
Common
to the
bay.
to the common bay and you can ask them for as much as you want. And they were not
Okay.
going they're not going to give you they'll give you as much as you want.
And the time that they have dedicated for the exam, which was like 6 hours on the technical
Yes.
skills day, was that enough?
I believe it's enough. I remember I was even the first person to leave.
Because I
I left.
remember you used to do the task quite quickly, even when you're
Yeah.
practicing before the exam. So I don't think so that was a problem. But do you think that the candidates usually have problems with the time?
No, I believe it's going to take you a little bit longer than what you're used to as well because you're in a different environment, different clinic. Even though everything is right there and given for you, you are going to waste a bit more time, I would say.
And
But
especially because you're taking care of the infection control and everything. So it does
exactly,
add up time. But
yeah,
six
exactly.
hours, you say, is
It should be
definitely
enough.
enough for completion of all the 6 technical tasks that you need to do. All right.
Absolutely. Yeah.
Now, coming on to the clinical skills day, just a few things about the communication. So,
Yeah.
how did you find the examiners? Like, do they ask a lot of questions?
With the clinical day, so with the communication part, yes. Yes,
Mhm,
so some of it really depends on the examiners. Some examiners were not very talkative.
mhm,
Others were extremely talkative, as I've mentioned earlier.
mhm,
But the majority were fine. Like they were, it was more or less of a back and forth conversation.
mhm.
So
So the
they would ask
questions, yeah. So the questions that they ask, do you feel that it's something out of the case, or it's relevant to the case or the task that you have for that station?
absolutely not. All relevant, and even sometimes if they like, of course, to a degree, if they think
Mhm.
that you might be steering away from the conversation, they will try
They
to
bring you back.
indirectly bring you back. Yes.
Okay, all right. Now with the technical OSCEs, because you have 4 stations of the technical OSCEs, so how was your experience? How was your stress levels? Because you had an examiner who was watching you the entire 10 minutes, right? So how was about that with the technical OSCEs?
Well, they don't really like, even though they do monitor you anywhere, they really give you your space.
Mm-hmm,
So it wasn't extremely stressful, I would say.
mm-hmm.
Uh, I mean, I remember I finished all of the tasks before the time ended. So everything was fine. Like I didn't feel that I was rushing through any of the 4 tasks that I had. But to be fair, I also got, I mean, I was lucky. I got 4 of the shorter tasks to be completed. I got the the extraction, the anesthesia, the X-ray tasks, and the only task, and the scaling task. I guess that was the longest one out of all of
Now,
them.
one more thing that I would also say about you is that you never had the chance to do these technical OSCEs, to practice them at an academy or something, right? Before the exam, or especially once you were in UE. So how were you practicing for these technical OSCEs?
Well, I had 1 day of practice, as you recall. I just did
That was
with
just before
one
the
guy.
exam, right?
That was just a couple of days before the exam. But before that, I would just try as much as I can to replicate the scenario at the clinic, and I will just apply it on the mannequin. So I would time myself. I always had a timer on the phone. I would start with the infection control steps that you've described in the course, and then I would have like a common bay very similar to what I would have in the exam. I would pick it out, put it on the bracket table, and let's say if it's a rubber dam task, I would prepare the rubber dam, get it sorted, place it, and all that, and I have time. I have a timer going on so that I know that I'm
So
trying to work with.
basically, you practice watching our online videos, and you used to practice with looking at the time frame that you have for each task, so that you don't exceed the time frame. And
Exactly.
then
Yes.
a few days before the exam, you attended an on-site to refresh your memory and have the exam environment experience. And that was about it with respect to technical OSCEs.
Yes. Yes. You could say that. Yes.
Okay, all
Absolutely.
right. Now, well, I think those were the questions from my side, just to give the candidates. So, what would you say, like, to summarize, uh, any tips that you would like to give to the future candidates in terms of preparation and the courses and the approach that they need to take for the exam?
Okay, so I would say when it comes to the preparation, they just need to give themselves enough time that they're comfortable with. Okay, because we all have responsibilities, we have work, we have family, so it's understandable that it's not going to be the only thing we're going to be focusing on, right? So they need to give themselves time. If it's a family member that has a lot of has a big family and they need to, or they have like a difficult work schedule, they will need to factor this in, give themselves enough time to practice so that they wouldn't also ignore everything else. I guess also it would be good to figure out what your strengths and weaknesses are. If you're someone that has it's very good at the technical, then maybe start with the communication part because it might be a bit newer to you. I guess it would be the other way around for those that have been living in Australia and working as DAs and clinic management just for quite some time. So I think the opposite would be applicable. As for the course, as I told you, I've only relied on your course and it was more than enough for me.
So for your preparation, you completely relied on our course, and that was about it.
Yeah. I mean,
And the
yeah.
assessments that you had when you used to send us our work. And I think we had like around 8 communication OSCE sessions with you.
Yes, we had. Yes.
So how
Yes.
did the sessions help you?
No, absolutely. I mean, I recall you even saw huge differences from each session to the other. So from one week to the next, it made a huge impact. I mean, reading the cases and practicing on my own is one thing, but having someone that actually understands the examiner's mindset reply back to me is completely, game changing, I would say.
Okay, all right, that's good. So basically, it means that the candidate needs to analyze, because the preparation is not standardized for each individual. It's different for each individual depending upon the circumstances, your strong points, your weak points, and then depending upon what you need to have more practice with. So it's not a standard approach, because some candidates will struggle with communication, some will struggle with technical. So you need to know where you stand. But I think Dr. Omar will agree with me, is that you will only know once you start practicing and preparing, right?
Absolutely, yes.
Because before that, it's all about it's a new experience, so everyone panics and they have difficulty. But once you start practicing, you start getting smoothly, gradually into the preparation mode. You will know, okay, I'm good at these things, let me focus on things that I'm not good at, and this will come with practice. And Dr. Omar, he did not just clear the exam in a weeks or a one time. I remember from the day he got the March exam and he messaged that he cleared the exam, From that day onwards, he started focusing on the practical exam, making sure to gather instruments and everything, making sure to, he got, I think you were the first one who actually enrolled in our practical course as well, and you started your
Oh,
practice.
really? I didn't
So
know.
this is, yeah, this is something that, no, I'm saying for the March batch, right? Once the results got declared, I think you
Yeah.
were one of the first few candidates who started. No, I'm just saying about the dedication. Like you had this eagerness to make sure that you're prepared for the exam and you started as early as possible. And that's what you got rewarded for. The earlier you start your practice, the more practice you can do, and the more comfortable or relaxed you might feel as you get closer to the exam, because there are certain criteria that you need to unlock. You cannot just say that I'll do practice, because practice without guidance is useless. You don't know where you stand and you don't know whether your task fits within the ADC marking criteria. So you might practice for 2 years and then you fail the exam. And that happens to candidates because they don't have that guidance. They're not practicing according to the standards of what the ADC wants from each candidate in the exam. All right, Dr. Umar, one last question. Now, you see, you were a batch of 12 candidates, right? We had, I
Yes.
know, sorry, 24, because if you count both the
24.
days.
24. Yeah.
And we had 6 candidates which were part of our course, and
Okay.
6 of them actually passed with you. You, Dr.
Ah,
Medha,
really? That's
Dr.
actually very good to
Asma.
know.
So these 6 passed. Now, what is that sets apart, right? Because maybe, okay, if our course had 6 candidates who cleared, there might be other candidates as well. So let's say total 8 to 10 candidates cleared, right? Out of 24, let's say. So what
Okay.
is that thing which sets apart a pass and a fail candidate? Because to tell you frankly, everyone prepares, right? It's not that someone will sit for the exam without preparation. So what is that thing that sets apart a pass and a fail candidate? I'm not asking you with respect to the courses, all right? You shouldn't, like, I'm not saying which courses you attended or how the course benefited you. No, I'm just saying because I know you attended our course and all 6 candidates who cleared the exam were part of our course, so I know that. But what is that thing that sets apart a passing and a failing candidate?
I think it has to do with how you receive critique.
Mhm.
So let's say I've been practicing one way and I'm making a mistake in a particular part of a task.
Mhm.
The way I'm going to receive the critique from you and how to apply it, I think that's what makes a difference. Because as you mentioned, some dentists, they practice and practice and practice, and whether they have guidance or they're not able to apply that guidance to their work,
You see,
I think
yeah,
that's
that's very important thing, which reminds me of one other thing is that sometimes, you see, for us, everyone is equal. We don't treat anyone superiorly or inferiorly. For us, all candidates, whether it's a written exam or practical exam, we welcome all questions. We always try to make sure we reply to them, and we try to make sure to give them the best materials and everything to prepare for the exam. Now, one good thing that I saw with Dr. Umar and all the other candidates who cleared with him as well, who were part of our courses, is that whenever he asked me a question, whether it was a communication OSCE or a communication OSCE session when we had, I used to give him feedback for each case that he presented, and also the technical task that he used to send me. He never said anything like, okay, I know, I will do this. I know, doctor, you don't need to tell me this. So this approach is, this mindset is a very positive mindset. So when we criticize or when we pick up mistakes with the tasks or the communication OSCE sessions we have, and we give you feedback, it's to help you. All right. We are not here to degrade any candidate or tell them you are not good enough. That's not our task. That's why we never, even in our written exam, mock exams, and the practical exam sessions we have with the candidates, communication sessions, we never tell the candidate whether it's a pass or fail. What we instead try to say is that these are the mistakes. Try to make sure you do not carry on with the same mistakes in the next cases or the next task you do. And whenever I used to say this to Dr. Umar, he always used to listen to that very carefully, not responding to me in an aggressive way, because we have some candidates who say that, yes, doctor, I know that, I will do this, but 10 tasks later, he's doing the same thing again and again. So you need to have a learning mindset, and everyone should have this mindset, a positive mindset, because every task you do, every feedback you do is a learning experience. If we do point out mistakes in your task, we are doing it for your benefit. I can easily say that this task is good, carry on. But I don't want to do that, because you will see sometime, Dr. Omar, that I criticized you in the communication OSCEs when you were doing the sessions with me. In the early sessions, I used to pick up so many mistakes. And that was the learning point, because you learn from that. And as you carried along, you made sure that you're not making the same mistakes. And the same with the crown, because with the crown task and the endo task, when you used to do the task, when you used to show us, I used to pinpoint the mistakes. But as you get closer to the exam, when you showed us the task, maybe I just said, very good, it's really nice, because all those mistakes were not seen anymore. So this is a
Yeah.
learning attitude that every candidate, irrespective of written or practical exam, or any path you take in your life, any exam you take in your professional dealings, in your personal dealings, you have to have a learning mindset, a learning attitude, and a positive mindset. All right. So yes, Dr. Omar, congratulations, and thank you so much
Thank
for
you.
your time. And I
Thank
know
you,
it's
Dr. Kamal.
Friday and it's an afternoon time for you, and taking time out to help the candidates.
Yeah,
It
anytime, Doctor.
really means a lot, and it also gives the candidate the opportunity to understand the exam. And it's not about just attending courses and throwing your money away, spending dollars and dollars, and then when you receive the result, it's not something that you would like to see. So it's not only about that, it's about the right approach, right mindset, knowing the criteria and following the criteria. If you agree with me, Dr. Omar, the exam, after you walked out of the exam on day 2, you would
Yes.
say that you were thinking that this was the exam that I was stressed about. After the
Yes, of
exam,
course.
you have this feeling, right?
Yeah, of course. I was like, okay, it's done. And I mean, I know that I did what I could. I know that I
Yeah,
applied what I can.
yeah.
So, but yeah, I mean, to be honest, I was stressed about
Okay.
it a lot more than I was supposed to be.
Supposed
If
to be.
that
And
makes
that's how it is. Because, and the one thing that I would say is to decrease the stress level is that your preparation level, it holds true for both the exams, whether it's written or the practical. If you are prepared enough, if you are prepared well, you have less stress levels compared to someone who isn't prepared or is not dedicating times towards their preparation. Because the more prepared you are, the more aware you are, and the less stress you will have as you go through the exam. All right, Dr. Umar, thank you so much. Is there any candidate that would like to ask any particular question from Dr. Umar? Please don't ask the cases, how he did the cases, what were the cases. These things are not to be answered here. But if you have any general question regarding the exam and the preparation, so more than welcome to ask Dr. Umar.
Yes, please.
Okay, I have a question.
Yes, please.
Okay.
Hello.
Yes, please.
Yeah. First, congratulations, and
Thank you. Thank you.
hopefully the best of luck for the next. Just I want to ask about the OSCE preparation
Okay.
for the communication. How you prepared it? Because
So,
I just I okay. Just go on.
okay. So what I used to do is that I always had my computer or my iPad with me and a note with paper. Okay. So what I
Good.
would do is I would give myself 3 minutes to read, which is the reading time that you're going to have in the exam. Okay. I read the case, and then I
Okay.
start to make a very short scheme. Okay. This is going to be the scheme of questions. I write it down very quickly within those 3 minutes. That will be the scheme of questions what I'm expecting to ask. Of course, in the exam, as I mentioned earlier, it might be a little bit different than the cases that we have in the portal, in the ADC portal, because some of those questions will be already answered in the case. So whatever I see that I haven't already, that I don't have, I will just write it down on the scheme. And then once you have the 10 minutes, I start asking questions. Because I didn't have a study partner, I would just wait some time, maybe like I'd say 5 to 10 seconds, as if the patient is applying to me. And then I would move on to the next question, and I would do so, and I'll just keep on going like so until I finish the case. Okay?
Okay.
Yes. Does that answer
Okay,
the question?
but you first read the communication case as it in the portal. You first read it as a whole, and next you did what you are just telling me, right?
Yes, it's very important always to read the very last sentence in the case, because usually
Okay.
that's what they're expecting you to do. So the first paragraph is usually case history, but the very last sentence usually is what the examiner is expecting you to do. So they would say, gather information or answer the patient's concerns or give a differential diagnosis. So this is what they're going to be expecting you to do. So this is the most important part of the case. The scheme is there to guide you through the questions that you're going to fulfill the task of that case.
Okay. And regarding the time, it was okay during the preparation, or at first it would take more time, and they're trying to convince the time.
No, of course, it took sometimes. It like when I first started with the communication OSCEs, I would take almost double the time when I was practicing on my own. So
yeah,
yes, of course.
This is why I felt.
This
is why I felt when I go through the communication set, I found that I will take more than 10 minutes definitely. So this is what I'm starting right now, just to condense the content, or just try to figure out how to make it shorter.
Yes, I mean, even if Dr. Reza recalls, in my very first session, some cases I've actually spent 15 minutes, and I wasn't even aware that I've taken this much time. But with practice, you start. I wouldn't say condensing your answer as much as just saying the important part of the answer, so that you also can save
Staying
up more
relevant
time.
to the case, I would say, because I remember when you started, you were asking me a lot of things which were not relevant. But I think after a few sessions with you, you were back in track, and you used to finish the cases in 10 minutes. I think sometimes within 9 minutes itself. So it's more about, once you start practicing, you realize that how much information I need to give if I'm explaining a disease, how much time should I take to explain the disease, when I'm giving the treatment options, how much time should I take to give the treatment options. So this comes with practice, of course. Once you start, of course, you start thinking that, how can I do this within 10 minutes? But with practice, things change, of course.
Okay, Dr. Raza, please, just one question for you also.
Yes.
Is it, as the communication cases on the sets we have in the portal, it has a lot of questions. So, which mean it gives me the variety of questions, not mandatory to make it as it is.
Yes,
like,
as Dr. Umar just said, that sometimes most of the information is given to you in the case. For example, the patient comes to you and he says that my tooth is hurting while I'm biting on it, and also it hurts when I have coffee and any hot drinks. So let's say you have this information. Now, when you're asking the questions, you should not be asking, does your tooth hurt while you bite? Or does your tooth hurt while you're having hot and cold? Because that information is given to you in the case, right? So you're wasting your time. So with practice, you will know what questions I need to ask. And of course, interpreting the case that is given to you in the exam and what information is already given to you. So you can skip it. For example, if the case is that the patient is having a prosthetic heart valve and they're taking warfarin for the last 4 years. So you don't need to ask the patient that, do you have any medical condition? Do you have any medication that you're taking? You're wasting your time asking these things. In fact, what you should do is that I can see from your history that you have a prosthetic heart valve placed and you're taking warfarin for that. Can you please tell me more about it? When was your last time you saw your doctor? Have you been doing any regular testing for the medication warfarin that you're taking? So this is how it is relevant now. But if you ask the patient, do you have any medical history, any medications you are taking? Because this information is already given to you in the case, so you're wasting your time. So this is how smart interpretation works.
Okay.
All right. And this will come with practice, of course. I don't expect you to know everything now because it's just been a week or 10 days. You might not have even finished reading all the cases, but this will come with practice. And then once we have the sessions, I will try to refine and refurbish the way that you are doing it.
Okay, yeah. Just one last question.
Yes, please.
Regarding your experience, especially with OSCEs. Do you feel that the examiner was a little bit friendly or communicating well with you, or just trying to drop you out? Or
okay,
so
no one
how
was
you feel
trying.
How you feel them?
Okay, no one was trying to fail me for sure. Okay, however, they intentionally will give you different characters, because as I mentioned earlier, some are going to intentionally be talkative, okay, because they want to see how you're going to respond. Others are going to be intentionally quiet, while some others are going to be happy, like cheerful patients. And some, I remember I had one that the very first OSCE task, the one that I told you I failed, the communication task, the patient was not very cooperative. So if I would ask him a question, he would reply in a manner saying, "Yeah, I already mentioned that it was a denture case, the one with the precancerous ulcer, doctor, if you remember that case."
Yeah.
Yeah, he would reply saying, "I already mentioned that I'm
Well, just to
uncomfortable."
brief, well, sorry to interrupt, but just to brief, what he's trying to say is that not all examiners are going to behave the same way. Some will be quiet, some will be talking a lot, some will not be very much interested in what you are saying. So this is something that they
simulate.
do on purpose because they want to
Yeah,
see
simulate
how
differently.
they want to see how
Okay.
you tackle every type of patient because not everyone will be the same. Because remember, it's not a speech, it's a communication. It's not one way, it's two ways.
Yes, but
Okay.
doctor, the last thing you need to understand, if a patient during the 10 minutes is not, or they started off being dismissive or quiet, it's not because they don't like you as much as, no, they want to see how you're going to respond to them when they're being like this.
Yeah, because some candidates, they say that the examiner was not very happy and they think that they will fail the station, but when they get the result, they pass that station. So it's not about how the examiner behaves during those 10 minutes, because they might behave with you in a way that you think, okay, he's there to fail me, but that's not the thing. They are behaving this way because that's what their behavior is expected. They are trained to behave that way. They cannot just sit and listen to you all the time.
Okay. Just
right.
last one. Regarding their answers or their statements, it was fully understood in terms of accent and language.
5 out of the 6 OSCE cases, yes, they were speaking very calmly and with a I wouldn't say a very strong Australian accent, except for the one with the very talkative patient. I think the dentist also, I mean, the examiner chose to use a bit of a stronger Australian accent to see if I'm going to understand, because in the end, this is also an English exam. So they will. So, but that was the only case where the examiner chose to have a slightly stronger Australian accent. But the other 5, no, they were very clear.
Okay, but you can always, like, I think you can always, if there's something that you couldn't understand in the first go, you can always say that, I'm sorry, can you please repeat this for me? So there is no harm in saying that, because a lot of dentists that are practicing here are of Arab origin or Indian origin, and they don't have the Australian accent. So when we have kids that come to us, especially who are, native Australians, their accent is very, strong. So they will just say, how are you doing? For how are you doing? They'll say, how are you doing? Understand? So you can always tell them that, I'm sorry, can you please repeat this for me? But I personally believe that they try to make sure that it's understood at least to a level that you know what the patient is. Some here and there, you might have difficulty, of course, but usually it's something that you will understand. It's not that they will just talk to you where you don't understand anything.
Okay, fine.
All right. Thank you. Any other question? Priya, you have raised your hand. Do you need to ask anything?
Yes, Dr.
Yes,
Raza,
please.
actually, I want to ask to Dr. Umar or Dr. Fayyad. So what day you had your OSCEs? Was it the first day or the second day?
It was the first day, but I think it was the opposite for half of, so we were 24 people. 12 had it on the first day, 12 had it on the second day. In my case, it was the first day.
Yes, actually, because I sat my exam that day. I sat my OSCE the second day, and I wanted to confirm something. If any of you sat your OSCEs on the second day?
I think, Dr. Priya, we have Dr. Umar here with us, but we don't have Dr. Megda and Dr. The other 3 dentists who, because of time constraints, are not part of the session right now. But I'll try to let them know, and I'll try to provide their contact to you so that you can discuss with them. I think that would be
sit down here and do, because they might call Rosella as well, so I need to run. So I better I sit down here and finish.
Okay, thank you.
All right. Any other question, please? Any other candidate? We have a few questions in the chat. Are we allowed to use anti-fog in the technical? Is it provided, or can I bring it? I would say you have the tape that is provided to you. on the top of the mask. You can use that tape if you need to cover the top portion of the mask. If you have the problem of fogging, they can provide you with the tape, and the tape they provide you with unlimited amount, so you don't need to worry about that. Okay.
I was asked, doctor, which amalgam I was using. It was the one that I bought from Navada. I bought the standard mix from the Navada website, and that's the one that I was using throughout my practice.
So with the amalgam, he is saying that the one that he practiced with was from the Navada website, which is in Mumbai. I think in the ADC home setup video, I've also mentioned that. So for practice, you can always purchase that and you can practice. Okay.
And as for the provisional crown, yeah, I used to get a lot of deficiencies. Actually, Dr. Raza would remember.
Sorry about the provisional. Yes, I do remember. But I think as you get closer, your provisional started to look really, really good.
Yeah, thank you. I think it had a few like it just needed some adjustments with the Vaseline. So I remember for a long time throughout my practice, I wasn't applying enough Vaseline around the contacts and under the height of contour of the contacts. So it always gave me a hard time pulling out the provisional out of the tooth. And I always had a lot of gaps because I used to apply a lot of Vaseline on the finish line. But even still, like when I used to have a lot of gaps, I used to repair them with flowable composite all the time. But the more closer I got to the exam, the less of a problem I had. And while I was able to complete the provisional crown by repairing the defects, the closer I got to the exam, the less defects I had. So it took me less time to finish.
It's more about practice, and you will realize how to avoid the mistakes. Okay. Any other question, please? All right. Yeah.
Sorry, because I joined in the meantime, so I'm not sure if this is answered. I want to ask Dr. Omar that how long did you prepare for the practical exam since you passed your written exam? Thank you.
I took around 4.5 months. It was roughly 4.5 months, I would say.
4.5 months. Okay. Thank you.
And hopefully this video will be posted in the Academy's private group as well. So he has detailed on how he took the approach and everything. So you can also watch it later. And if you have any questions, you can always ask me later as well. But this video will be most likely posted in the group as well. So you will know the approach that he took, how much time he took, what preparation strategy he took. So everything will be explained. So you can watch the video later on as well. Okay. Anything else, please?
Okay.
Thank you. Thank you so much.
All right, that's fine. So hopefully everyone is going to follow the path of Dr. Omar. And like he said, that it's all about the preparation and making sure you dedicate time towards the preparation, making sure that you do fulfill the ADC marking rubrics. And then, of course, need to make sure that you perform well in the exam. So thank you, Dr. Omar. Congratulations once again. And we wish you all the best for everything. Of course, if you need any help, even after clearing the exam, it does not mean that we are not in contact with you. You can always ask me for any prerequisites, anything about APRA, and we'll be more than happy to help you with that as well. All right.
Thank you so much.
Thank you so much, and have a good day. Take care.
Thank you. Goodbye, everyone. Thank you.
Thank you.